sentence when it shouldn't be, that cancer is devastating when a member of the family or the community is infected. It's like telling the truth of what to expect of cancer. But experts are saying that some cancers can be treated. Some cancers can also not cause the death sentence that a lot of people fear when they are diagnosed with cancer. Research and medication and science all put together have made this possible. And this is our focus today as we present another edition of Bridges. Thank you for joining in. Today is special in the way that we're looking at cancer, not in the usual sense of it, but in the unusual that will make the usual something to be able to live with. So in order to find lasting solution to cancer concerns in the country, you recall that in December of 2017, the President, Muhammadu Buhari, assented to the National Institute for Cancer Research and Treatment Establishment Bill 2027. This act is to provide national direction in cancer research, control, and treatment. And to realize and to make these workable, President Muhammadu Buhari in February also appointed Associate Professor Usman Malami Aliyu as the pioneer Director General of the National Institute for Cancer Research and Treatment, acronamed NICRAT. And that's where we're going today. Research and treatment, particularly for some cancers that are peculiar with the black man, or of course, very high in terms of prevalence in Nigeria. I have here with me to discuss this, the pioneer Associate Professor Usman Malami Aliyu as the Director General of the National Institute of Cancer Research and Treatment. Prof, doctor, oncologist, all roped in one, clinical and all that. Welcome on Bridges.
Thank you very much.
And thank you so much for, finding your time to come. We know that you're settling down, but cancer is such a serious health concern that we need to bring you on Bridges so that together with you, with what you're going to be doing with NICRAT, we'll be able to navigate and reduce the high prevalence of cancer patients coming up. Now, first of all, just say to us, how does this dovetail? How does your institute dovetail into the critical need for treatment, for care, for awareness, for research, all grouped into one?
So thank you very much, Moji, for having me. As she rightly mentioned, the institute was actually assented by Mr. President Muhammad Buhari in 2017. And then in January, I happened to be appointed the pioneer DG of the Institute. NICRAT, as we call it, usually has the mandate assented by Mr. President Muhammad Buhari in 2017. And then in January, I happened to be appointed the pioneer DG of the Institute. NICRAT, as we call it, usually has the mandate to take the leadership in cancer prevention, diagnosis, treatment, and control in the country. Yes, there were some pockets of activities, most especially in the space of awareness, cancer awareness in the country. But if you look, a lot of things that have been happening does not turn into action. They are not coordinated. So this center has the mandate to actually organize and coordinate virtually all the activities that are taking place in cancer space. These are the cancer prevention and awareness. Another mandate that the institute has is to actually ensure equity, which is actually the catchy words there that have been it has been the slogan for World Cancer Day, that close the care gap. So this institute tends to actually do that by providing the quality care, that is needed, make it accessible to virtually all the cancer patients within the country. It also has the mandate to embark on research, specifically on the issues that are related to cancer. It has the mandate to fund researchers, generate, look for sponsors either out of the country, in the country, and also provide a budget for those researchers in the country. Another very important key area that the Institute has mandate for is to resuscitate the activities of cancer registry. The cancer registry in the country are moribund actually. So it is now the responsibility of the Institute to actually resuscitate all the activities that are going on, be it a hospital base or a population base, and with also the hope of establishing a central polling unit for the cancer patient in the country. As you all know, if you don't have records, you can't do anything. You can't plan. And if you cannot plan, definitely, as they said, you have already made the plan to fail.
Okay. As a clinician yourself, and now that you also have the mandate to take leadership of this institute, what would you say would be your priority?
Okay. The priority of the institute, as I've mentioned earlier, is actually mainly in the area of prevention. Cancer prevention, as we also know, entails, or it has 3 stages. But of recent, I can say another stage has been added, which is called the primordial stage. It's primordial type of prevention in the sense that those is actually a kind of prevention in which those areas where those risk factors that are known for cancer have no reach, you are expected to do all that is required to prevent those risks from getting there. So that is the actual primordial prevention that is added to the first 3 that are known. The first one is health education. Yeah, what are the risk factors? You have to educate the people, empower them, let them know those things that causes cancer. It is only through that they'll be able to prevent themselves.
Yes, so we are on bridges. So let's talk about prevention, because treatment is still very expensive and not readily available sometimes. So what are the things
that causes cancer? If they know what are the causes, the risk factors of cancer, that you have empowered them, and it is only through that they will be able to prevent themselves from taking those. And what are these things that we are mentioning about? Abuse of alcohol, cigarette smoking, taking part with sedentary life. They are like many, they are more than 1,000. So I believe if you know them and you know what to do, you are empowered. If you are you eat a lot of fatty food, now you know that taking a lot of fatty food can lead you to obesity, and from there you can become predisposed to cancer. Then you regulate the amount of dietary product that you have taken. And even if you take, you know exercise is mandatory, then you have to exercise yourself. Like at least just the non-active one that they said, if you can embark on just 30-minute walk, with a simple walk, it suffices in a day. So this is just part of it. The second phase of prevention is early detection and treatment. So it is expected that the Institute and virtually all the other stakeholders, maybe in the space of cancer, do embark in screening programs that we know. So in screening, we go into the population. These are people that are somewhat healthy population, that doesn't have the disease, they are not aware that they have the disease. So you subject them to that screening survey, and through that you'll be able to pick and detect the cancer at its earliest form, and that is at a stage where it is curable, and you can easily pick those people and cure them of the cancer. So that is that. The third level is prevention of rehabilitation and prevention of disability. So it's meant for those that already have the disease, advanced to some extent, let them have the treatment that they require, full-blown treatment of cancer, and then the disability that they got from the cancer, let's see how we can integrate them into the society.
Well, there's the big one, the research, and that takes takes a lot of money. Takes you need special people who will be able to do this. How do you intend to coordinate this? So that research can also be part of the things that will quicken care and treatment.
Okay. So part of the mandate, as mentioned earlier, at the institute is to have a budget for research on cancer. So by doing that, apart from that, coordinate the activities of other researches that are ongoing in the country. There are actually pockets of researches that are going on in the space of cancer, but they are not coordinated. So actually we can guide the sponsors, the donor agencies, the international and the local, to actually know our priority in terms of the area of cancer where we actually do, and channel that resources to do what is actually required. The institute, the budget of the institute there is a budget that is actually dedicated for research. And that we intend to go into the cancer centers that we have in the country that are located within the tertiary healthcare system, and also the universities, to actually sponsor researches that will change the narrative of cancer in the country. As we know, two cancers are the same, and cancer is in blacks are different genetically from those in white. There are a lot of genetic variations. So, and that from there actually tells a lot about the treatment that is tailored toward them. Unlike what we are doing now with chemotherapy, most of the clinical trials that are conducted are with the white population. The targeted therapy are purely with the whites. The blacks are not involved. So we are grossly deficient. If it works in them very well, if we bring the same drug to black ones, it might actually not work the way you expect them to do. Well, even if it does, it will do just a little bit and a side effect. So there is need to actually bring those clinical trials or that kind of researches that will actually improve the quality of the intervention that we do in terms of diagnosis, treatment,
Well, I find this very interesting because that's the peculiarity for which the institute will work. In terms of getting people to understand this, that we need to have this research, that will speak to the peculiarity of our needs. What would you be asking viewers, for example? What are the kind of bridge that we need to build together so that this coordination and this research can happen? Well, it's happening now, but it has to be coordinated and it has to be fast-tracked.
Actually, the institute intends to actually engage the stakeholders in the area of research to actually let them know about the existence of actually this institute now, and through that to have a kind of a mapping strategies on the type of researches that we normally do, and then we to guide the scientists and the during the stakeholders meeting on the type of researches that the country is currently needed in the area of research. That is actually what we intend to do, and through that I believe during the stakeholders meeting we will be able to get the international donor agencies, the local.
Are they showing interest?
They are really showing very interest. As I mentioned earlier, they are currently sponsoring some of the researches that are ongoing in the country, because as you have rightly mentioned, research is capital intensive. So actually the main thing that we are lacking is coordination. So if we coordinate the activities of research in the country, we avoid duplication while we are doing so. We can stratify it and then model it in such a way that we can cover actually a vast area of cancer, so that at least we have a lot of knowledge in the area, and then we can quickly change the perspective of the diagnosis and treatment, including the prevention that we are giving.
Yes, let's also talk to treatment now in terms of medication that are needed. These medications sometimes are very, very expensive. People start and in the middle of it we cannot continue with it. What would the institute be contributing, to ensuring that at least some of these drugs, maybe we don't have to pay. People don't have to pay as much as they are doing now.
So there are actually some strategies that we actually intend to follow. The government has already started some activities. The president has approved through the legislators, the National House of Assembly, they have approved this cancer health fund for the cancer patients. So what we intend to do, although the sum is actually very small, but it's good that we have started. We intend to actually follow it rigorously to ensure free advocacy and see how the government of the day can increase the funding, so that not only the government, but even the well-to-do individuals, other stakeholders in the country, like the rich people, the businessmen that we have in the country, to contribute in that cancer health fund, so that we can fashion and tailor it more in such a way that it can reach the common man wherever you are. So that is to enhance the accessibility of actually treatment and funding in that area. Another area that we are actually thinking is to reach out to our sister agency, the National Health Insurance Agency, to actually have a discussion on how they can come in and increase the coverage. We have some part of drugs that are under NHIS, and even radiotherapy can cover to some certain extent. So all the modalities of treatment we intend to sit with them, let them see reason and increase the coverage of cancer to the actual common man in the society.
Well, we're looking at screening. What would be your advice? Because so a lot of times Nigerians are very skeptical about presenting themselves for screening. How important is this? I mean, considering the fact that NICRAT is going to, be able to coordinate some of these screening methods. Why is it that Nigerians, you're a clinician yourself, why is it that Nigerians don't want to present for screening?
Well, the reason is purely what you have earlier mentioned, that a lot of Nigerians take cancer to be a death sentence. So once we are diagnosed, we're going to die of it. So what we intend to do is actually to educate the populace that cancer is curable if detected early. So we reach out. We definitely reach out to a large chunk through the media and through individual one-on-one interaction, and ensure that the people have that knowledge. Once they have that knowledge, we know they are empowered. We follow all the facets of that follow through the churches, through the mosques, through the marketplaces, the rulers. That is what we call the advocacy. We go through that to actually enlighten those people in authority. Let them know that this is the reality about this cancer, and if people present themselves and they can really be cured, like the EMIA, the others, if they reach out to their people, their people can easily accept that, and they can.
I like the assurance that you give that some cancers, if detected early, can be treated. I think we need to emphasize this. I think that's the bridge we need to build here.
Yes. So definitely cancers, if presented early, can be treated, like breast cancer, cervical cancer. These are the two cancers that are actually at the high level of causing morbidity and mortality in the country. If we present early pre-intervention like breast cancer, a very simple one, you can easily be removed. Not the breast, but just the lung, and then the required adjuvant treatment can be tailored according to what is required. If it is cervical cancer, if a screening is done and a lesion is detected, that lesion can be ablated, and then subsequently the patient can be cured of that cancer. And it's part of the mandate of the institute to ensure that all the PHCs in the country have the knowledge and the equipment required to do screening for common cancers, and that's what we intend to push and ensure that virtually all the PHCs in the country, the functioning and many, have those equipments that are required for screening, and also to give the required knowledge for the healthcare workers to do the screening.
That's very important. I was actually going to speak to human resources. That what are those your concerns? The experts that are needed to work on these cancers, particularly screening at the primary healthcare level. Are you concerned about that? Is there going to be anything about that?
Yes, we actually have a vast array of experts lying over there in the Federal Tertiary Teaching Hospital, the NGOs, the international, that can do it. So what we intend to do, we want to map out a kind of the stakeholders meeting to discuss about that, fish out all the experts that we have, make them into groups, so that at least we have, maybe we train those, we have to get the backup support to train these trainers, to equip them fully on how to operate those tools that are required to perform the screening before sending them out into the localities.
So this is important, yes. So we're looking at almost, all the devices that are needed, human resources, availability of, the screening, and also be able to do prevention, and of course the big one, the research. Well, as we wind up on today's edition, or this special edition on should I say, cancer and the hope that your institute will give, what would be your final word? What would you be saying to viewers out there as we together want to build a bridge?
Okay, so I want to actually wrap it up by thanking the federal government and the federation for bringing life into life this our great institution, and to tell the populace that diagnosing cancer is actually not a death sentence. Present early and you'll be cured, just like malaria and any other diseases. And NICRAT is out there to do that. And in the near future, very soon we'll start feeling the impact of the government in all those areas that we have mentioned.
Does this give you, are you fulfilled as an oncologist heading this new institution?
This hope, it gives a lot of hope. In fact, I can say that I'm fulfilled because I know the avalanche of reaction that was triggered when the announcement of my appointment came into the National Cancer Society, Medicaid Cancer, and so many other agencies. They couldn't hide their joy and fear they were in the media avalanche because they see her now. We have to commend the government for actually bringing.
And it's not peculiar in other countries of the world. You have an institute like yours.
We have National Cancer Institute in other countries, like in Egypt. It's up to their Cancer Institute is there about more than 14 years, and that is why they are doing extremely well. I happen to be trained there for like 6 months, and the things we saw, the coordination and the research, how they manage their cancers. In fact, in the area of bladder cancer, which is the commonest in one of the cancers that are hitting the country hard, they are the authority in terms of prevention, diagnosis, and management of that cancer in the world, because they have the National Cancer Institute. And there we are having our own we have to replicate and even do more, because we are the giant of Africa, as they said. We take lead and others follow.
That's it. I like that. We take lead and others follow, and that's Hope Rising for treatment, for prevention, and of course research on the peculiarity of cancers that that Nigerians suffer from. Prof, thank you so much for coming on this program. We wish you luck, and we'll track your success, and we'll partner with you to ensure that the burden of cancer is reduced in the country. Now, the take home for me on this program today is the fact that he said when you present early, there's the likelihood that you will get treatment and you can get a cure. So encourage somebody to go for a screening, encourage somebody, to ensure that when that C word is diagnosed, you quickly present yourself for treatment. Bring you back same time next week.
African Roots presents Full Time for Children and Teenagers across Nigeria and the globe.
I just made that you learn a thing or two from
Showing every Saturday by 9:30 a.m. on NTA Network. It is going to be a fun time with Grandma Wura and all the new table talk with Dave and Jess. Catch you soon!
One of the most beautiful events in most people's lives is the arrival of a new life, one's own child. But what happens when such a gift comes with congenital issues, diseases, or deformities? It turns sweet and sour all in one. However, do you know that most of them are preventable and even curable? Yes. Join us on Conversations this Wednesday, the 26th of April, 2023, and learn how to keep our newborns fit and healthy. Congenital diseases is our focus. The time is 9 a.m. Make it a date.
This is the network service of the NTA.